Hey everyone, I'm back again, and today we are going to talk about nurse to nurse report, or we can also call it patient handover report. And let's talk about why it is so important. And this is where patient safety starts. You're passing critical information, critical diagnosis, PRN medications, changes in condition, everything to next nurse to keep our patient safe and alive. A good report is equals to few errors, better care, and smoother shifts. But let's be real, new nurses and students feel uncomfortable when they give report. Do you know why? It's because of the lack of confidence, fear of missing information, or not knowing what's important, and lack of practice or being judged by experienced nurses. And trust me, it is totally normal. Everyone feel the same way. When I was in practice, I didn't just wake up confident. I built it step by step. First day I gave report of one patient, next day two patient, and then started taking the whole assignment. My preceptor was really great. All three preceptor, I had three placements. They really helped me to become confident nurse in giving reports. Confidence comes from doing, not just by watching. I used to create structured format for my nurse to nurse report. I used to write important information, use pen with multiple colors, and then color code your information to know which is important, what is first you have to mention in your note. And practice out loud to your preceptor or to yourself. I used to just figure out everything in my brain, and I used to ask for my preceptor's feedback and even other nurses' feedback after giving a report to know what I need to work. And remember, you don't have to be perfect, just safe and clear when you give report. And I will share my report in the same video, and let me know if you have any question in comments, or maybe if I'm missing something in the report. My last placement was in NRT, which is a resource team. So usually resource team is like nurses who cover other nurses when they're calling out or they're on break or on vacation. So me and my preceptor, we used to go to different floors in hospital, medicine, cardiac, and so many other. I also worked in Emerge, and I used the same report format to build my report, and it worked on different floors. I know every floors have their own format for handover reports. But I usually work according to this report, and I'm gonna share how it looks like. I also have it in